Did you know that some of the medications sitting in your bathroom cabinet right now could be quietly speeding up memory loss and even increasing your risk of dementia? It sounds dramatic, but this isn't fear-mongering. It's a warning backed by science. Because while we all want to trust the medications prescribed to us, the truth is that not all drugs are safe for your brain, especially as we age. Millions of older adults rely on pills to manage sleep, allergies, anxiety, bladder control, heartburn, and pain. But new research reveals that some of these everyday drugs are quietly linked to cognitive decline, confusion, and long-term damage to brain function. And the scariest part? Most people, including many doctors, aren't talking about it. Today on the Wellness Vault, we're going to open the lid on this hidden danger. In this video, you'll discover 9 medications, common, everyday drugs that have been scientifically linked to a higher risk of dementia. These aren't rare prescriptions or fringe medications. Some are over-the-counter pills you can grab at any pharmacy. Some you may have been using for years. But here's the good news. This isn't about creating panic. It's about giving you the information you need to take back control of your brain health. For each of these 9 medications, I'll explain what it is, why it may be harmful, what the research says, and what to talk to your doctor about if you're concerned. Because let's face it, losing your memory isn't just about forgetting names or misplacing keys. It's about independence. It's about quality of life. And the earlier you understand these risks, the more power you have to protect your brain for the years ahead. Now, before we jump into the list, do me a quick favor. If you care about staying mentally sharp, or if you have a loved one who relies on daily medications, please take a second to like this video. Subscribe to the Wellness Vault for weekly health videos that go deeper than the headlines, and drop a comment below with the words, "I want to protect my brain." It helps the video reach more people and supports this kind of research-based content. Let's get started. Number 9 is beta blockers. The 9th medication on our list is a group of drugs called beta blockers. These medications are commonly prescribed to manage high blood pressure, heart rhythm problems, and even anxiety. You may recognize names like metoprolol, etanol, or propranolol. If you're over 60, there's a good chance you've either taken one of these or know someone who has. Beta blockers work by slowing down the heart rate and reducing the force of heartbeat. This helps lower blood pressure and reduces the workload on the heart. They are effective for protecting the heart and preventing serious complications like heart attacks or strokes. In that sense, they can be life-saving and are often considered essential medications. However, recent studies have raised concerns about their potential impact on the brain, especially in older adults. Because beta blockers lower blood pressure by slowing the circulation of blood, some researchers believe they may also reduce blood flow to the brain. Over time, this reduced blood flow could contribute to feelings of fatigue, mental fog, or even memory problems in some people. Several observational studies have reported that seniors who take beta blockers for extended periods may experience cognitive side effects. These can include slower thinking, forgetfulness, or difficulty concentrating. While not everyone will experience these effects, they seem to be more common in individuals who are already at risk for cognitive decline. What makes this especially tricky is that the symptoms can be subtle. A person might feel more tired or less mentally sharp and assume it's just part of aging, but in some cases it could be a medication side effect. Because beta blockers work on both the heart and the nervous system, they can sometimes affect mood, energy levels, and brain performance. To be clear, beta blockers are not the most dangerous drug on this list when it comes to dementia risk. However, they are widely prescribed, often for years at a time, and their potential connection to mental slowing is important to understand. Doctors often weigh the heart benefits against the possible cognitive effects, especially for older patients. If you're currently taking a beta blocker and feel that your memory or thinking has changed, it's worth discussing with your doctor. There may be other medications or adjustments that offer the same heart protection without as many cognitive side effects. The goal is not to stop taking a necessary medication suddenly, but to make informed decisions based on your full health picture. In the end, brain health and heart health are closely connected. Keeping your blood pressure under control is vital, but so is staying mentally sharp and independent. The key is balance. Always talk to your doctor before making changes, and never be afraid to ask if there might be a better option for you. Number 8 is non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs, or NSAIDs, are among the most commonly used medications in the world. They include familiar names like ibuprofen, naproxen, and others often used to relieve pain, inflammation, and fever. If you've ever reached for something to soothe arthritis, a headache, or back pain, chances are it was an NSAID. These drugs are widely available over the counter and are generally considered safe when used occasionally and at the recommended dosage. They work by reducing inflammation in the body, which can be extremely helpful for conditions like joint pain or injuries. However, long-term or frequent use, especially in older adults, has raised concerns among researchers. Some studies suggest that when used over long periods, NSAIDs may contribute to an increased risk of cognitive problems. The research is still developing, but scientists have observed connections between regular NSAID use and a faster decline in memory or mental sharpness. The concern seems greater when these medications are taken daily over months or years. One possible reason is that long-term NSAID use can affect blood flow and other body systems that are also connected to brain health. Additionally, these drugs can sometimes lead to gastrointestinal bleeding or kidney strain, which in turn may impact overall well-being and increase vulnerability to cognitive issues. Another concern is that NSAIDs can mask symptoms of more serious conditions. A person may continue taking them for chronic pain, unaware that they are dealing with an underlying issue that requires different treatment. Meanwhile, prolonged NSAID use could be placing quiet stress on the body and possibly on the brain. It's also important to note that the risks are not the same for everyone. Many people use these medications safely and benefit from the relief they provide. The issue becomes more serious when someone uses high doses for long periods without medical supervision. Seniors in particular may be more sensitive to side effects and cumulative impact. If you find yourself taking NSAIDs frequently or relying on them every day, it may be time to talk with your doctor. There could be alternative treatments, physical therapy, or other medications that offer the same relief without potential cognitive side effects. The goal is not to avoid all pain relief, but to use the safest and most effective options available for your specific situation. Pain management is important, especially as we age, but so is protecting your memory and thinking ability. Always consider how often you use medications like ibuprofen or naproxen, and whether that long-term use is still the right choice for your health and your future. The seventh medication on our list is a group called bladder antimuscarinics. These drugs are commonly prescribed to treat overactive bladder, frequent urination, or incontinence, especially in older adults. Names like oxybutynin and tolterodine might not sound familiar at first, but they're widely used in the senior population. Bladder antimuscarinics work by relaxing the muscles of the bladder, which helps reduce the urge to urinate frequently or urgently. For people dealing with embarrassing or disruptive bladder issues, these medications can seem like a lifesaver. They allow for more normal routines and fewer accidents during the day or night, but the way these drugs work is also what makes them risky for the brain. They affect a chemical in the body called acetylcholine, which plays a major role in memory, learning, and overall brain function. When this chemical is blocked for long periods, it can lead to problems with thinking, recall, and even increase the risk of dementia in older adults. Multiple studies have found a connection between long-term use of bladder antimuscarinics and faster mental decline in people over the age of 60. Some of these effects may be subtle at first, such as forgetting names, misplacing items more frequently, or feeling foggy. Over time, however, the decline may become more noticeable and harder to reverse. What's especially concerning is that many people are prescribed these medications without being told about the potential impact on brain health. They are often taken daily for months or even years, and because bladder issues are common with aging, the use of these drugs is widespread, yet the long-term risks are often not discussed. If you or someone you care about is taking one of these medications, it's important to be aware of changes in memory, focus, or mood. While not everyone will experience side effects, seniors are more vulnerable to them, and early signs should not be ignored. This is especially true if other anticholinergic medications are also being taken at the same time. There are newer medications and non-drug treatments for bladder control that may have fewer cognitive risks. Pelvic floor exercises, timed bathroom visits, or alternative medications can be effective and safer in some cases. Talking with your doctor about these options can help you manage bladder symptoms while still protecting your brain. Maintaining dignity and comfort with bladder control is important, but so is preserving memory and independence. If a medication could be quietly contributing to memory loss, it's worth asking whether a safer solution exists. A simple conversation with your doctor could make a big difference in how you feel both physically and mentally. Number 6 is opioids. Opioids are powerful medications used to relieve pain, especially after surgery, injury, or for chronic conditions like arthritis or back problems. You might recognize names like oxycodone, hydrocodone, morphine, or tramadol. These drugs are prescribed millions of times each year and can be essential for managing severe pain. They work by binding to receptors in the brain and nervous system, blocking pain signals and producing a calming effect. For many people, opioids offer much-needed relief and can improve quality of life in the short term. However, when used for extended periods, they can lead to more problems than they solve. One of the growing concerns about opioids is their effect on the brain over time. Research has shown that chronic use of these medications can lead to changes in brain structure, especially in areas that control decision-making, memory, and emotions. These changes may happen slowly, but they can become more serious the longer the medication is used. Seniors are especially at risk because the brain becomes more sensitive with age. Even moderate doses over long periods can cause mental fog, forgetfulness, slower thinking, and sometimes even confusion. In some cases, these effects can mimic or contribute to dementia symptoms. Opioids also increase the risk of depression, which itself is a risk factor for cognitive decline. Another problem is that opioids can dull not only physical pain, but also mental sharpness. People often report feeling slowed down or out of it while on these medications. These symptoms can make daily tasks harder, increase the risk of falls, and reduce overall independence. Unfortunately, these changes are often blamed on aging, instead of recognizing a possible medication side effect. To make matters more complex, opioids can be physically addictive. The body builds tolerance over time, requiring higher doses to get the same effect. This increases the likelihood of side effects, including those that affect brain health. And once someone is dependent on opioids, it becomes harder to stop taking them, even if the pain improves. That said, there are cases where opioid use is necessary, and not everyone will experience cognitive side effects. The key is careful management. Doctors now recommend using the lowest effective dose for the shortest time possible and exploring other pain management options when appropriate. Physical therapy, anti-inflammatory medications, and alternative treatments like acupuncture or topical creams may help reduce the need for opioids. If you or someone you know has been on opioids for more than a few weeks, especially if memory or mood changes have been noticed, it is worth having a conversation with your doctor. There may be safer approaches that still offer relief. Protecting your brain while managing pain is possible when the right balance is found. Number 5 is statins. Statins are one of the most widely prescribed classes of medications in the world. They are used to lower cholesterol levels and reduce the risk of heart attacks and strokes. If you take a medication like Lipitor, Crestor, or Simvastatin, you are taking a statin. These drugs have been credited with saving lives by preventing heart disease. Statins work by blocking a substance the liver needs to produce cholesterol. This lowers the amount of LDL, or bad cholesterol, in the blood. For people at high risk of heart problems, statins are often considered essential. Doctors frequently prescribe them to people in their 50s, 60s, and beyond to help protect against future heart issues. However, in recent years, some researchers and patients have raised concerns about possible cognitive side effects. While the medical community is still debating the exact relationship, there have been reports of memory loss, confusion, and trouble concentrating in some people taking statins. These symptoms usually appear after starting the medication and may go away if the drug is stopped. One theory is that since the brain is made up of nearly 60% fat and requires cholesterol to function properly, reducing cholesterol too much could interfere with brain performance. The brain uses cholesterol to build cell membranes and help with nerve communication. Cutting off this supply might impact memory and thinking ability in some individuals. It is important to note that not everyone who takes statins experiences these effects. In fact, most people tolerate them without any problems. But because statins are so common, even a small percentage of people experiencing cognitive changes adds up to a large number of affected individuals. For seniors, the risk may be higher due to the natural decline in brain function with age. If you are taking a statin and have noticed new memory problems, fogginess, or mental fatigue, do not stop the medication on your own. Instead, speak with your doctor. They may consider adjusting the dose, switching to a different statin, or evaluating whether the benefits still outweigh the risks in your specific case. Some people find that changing lifestyle habits, such as improving their diet or adding regular exercise, allows them to reduce or even eliminate the need for statins over time. This should always be done under medical supervision, but it highlights that medications are not the only path to heart and brain health. Balancing cholesterol control and cognitive clarity is not always easy, but it is possible. The goal is to protect both your heart and your brain as you age. With the right support and regular check-ins with your healthcare provider, you can make informed choices that help you stay sharp and strong for years to come. Number 4 is proton pump inhibitors. Proton pump inhibitors, or PPIs, are medications used to treat acid reflux, heartburn, and other stomach acid-related conditions. You may know them by their brand names like omeprazole, Nexium, Prelosec, or pantoprazole. These drugs are often recommended for people with GERD or ulcers and are even available over the counter in many cases. PPIs work by blocking certain enzymes in the stomach lining that produce acid. This helps reduce irritation in the esophagus and stomach and can be especially helpful for those dealing with persistent heartburn or indigestion. They are typically intended for short-term use, but many people end up taking them for months or even years. Recent research has raised concerns about the long-term use of PPIs and how it might affect brain health. Some large observational studies have found that seniors who take PPIs regularly may have a higher risk of developing dementia. While the exact cause is still being studied, researchers suspect several possible explanations. One theory is that by reducing stomach acid, PPIs may interfere with the absorption of important nutrients like vitamin B12. This vitamin is essential for healthy brain function, and low levels over time have been linked to memory problems and cognitive decline. Seniors are already at risk of B12 deficiency, so adding a PPI could make the problem worse. Another concern is that PPIs might indirectly affect gut health. Your digestive system and brain are more connected than many people realize. A healthy gut helps regulate inflammation and supports brain function. Changing the gut environment with long-term acid suppression may disturb this balance, possibly influencing how the brain performs over time. It is important to understand that PPIs are not harmful for everyone. They are very effective when used properly and for the right amount of time. The risk seems to appear mainly when these medications are taken daily for extended periods, often without re-evaluation. Unfortunately, this is quite common in older adults. If you've been using a PPI for more than a few months, especially if it is something you started taking years ago and never stopped, it may be time to check in with your doctor. There may be lifestyle changes, dietary adjustments, or alternative treatments that can manage your symptoms with less long-term risk to your cognitive health. Your digestion and your brain may seem unrelated, but they are more connected than you think. Protecting one can often protect the other. Always weigh the benefits and risks of long-term medication use, and never hesitate to ask your healthcare provider if a safer plan might be available. Number 3 is benzodiazepines. Benzodiazepines are a class of medications used to treat anxiety, panic attacks, and sleep disorders. You might know them by names like Xanax, Valium, Ativan, or Klonopin. These drugs are often very effective at calming the nervous system and helping people feel relaxed, especially during times of high stress. They work by enhancing the effects of a chemical in the brain called GABA, which has a calming influence. This is why they are helpful for people who struggle with intense anxiety or insomnia. In the short term, benzodiazepines can offer relief and improve quality of life when used carefully. However, long-term use of these medications has been linked to serious problems, especially in older adults. Studies show that taking benzodiazepines regularly for several months or more may significantly increase the risk of developing Alzheimer's disease or other forms of dementia. In some studies, the risk increased by over 50% after just 6 months of regular use. One reason is that these medications slow down brain activity. While that is helpful for anxiety or sleep in the short term, over time it can reduce brain plasticity, which is the brain's ability to form new connections and learn new things. This slowing can lead to memory problems, confusion, and reduced mental sharpness. Seniors are particularly vulnerable because their brains are already more sensitive to medication. Even low doses of benzodiazepines can cause problems like daytime drowsiness, falls, forgetfulness, and disorientation. These effects are sometimes mistaken for normal aging, but in reality, they may be avoidable side effects of the drug. Another concern is dependence. The body can become used to the medication, requiring higher doses to get the same effect. This makes it harder to stop taking the drug, even if side effects begin to appear. Withdrawal symptoms can be unpleasant and even dangerous, which is why reducing or stopping use must be done carefully under a doctor's supervision. That being said, there are safer alternatives for managing anxiety and sleep issues, especially in older adults. These include therapy, lifestyle changes, relaxation techniques, or shorter-acting medications that are less likely to impact cognition. Discussing these options with a healthcare provider can help reduce the risks without ignoring the need for relief. If you or someone you care about has been using benzodiazepines for several weeks or months, and you've noticed changes in memory or alertness, it is important to speak up. The more options are available, your mental clarity is worth protecting, and there are paths forward that balance safety and symptom relief. Number 2 is diphenhydramine. Diphenhydramine is one of the most widely used over-the-counter medications in the world. It is found in allergy medicines like Benadryl and also in many nighttime sleep aids. Because it is available without a prescription and advertised for common symptoms like sneezing or sleeplessness, many people assume it is completely safe. But for older adults, this drug can carry serious risks. Diphenhydramine is part of a class of medications called first-generation antihistamines. It works by blocking histamine, a chemical your body releases during allergic reactions, but it also crosses into the brain and interferes with acetylcholine, a neurotransmitter critical for memory, attention, and learning. This is where the problem begins. In people over 65, diphenhydramine can lead to confusion, dizziness, and problems with balance. It can make you feel drowsy or disoriented, even the next day. These effects are often mistaken for normal signs of aging or simply being tired, but research has shown that long-term use of diphenhydramine is associated with a significantly higher risk of dementia. One major study found that people who regularly use strong anticholinergic drugs like diphenhydramine had a 54% higher chance of developing dementia. The more frequently and consistently the medication was used, the greater the risk. These findings are especially concerning because diphenhydramine is still found in many over-the-counter products. Even occasional use can cause problems in some seniors, especially those who are sensitive to medications or already experiencing mild memory issues. Taking diphenhydramine for sleep may seem harmless, but it could quietly be affecting your brain health over time. It also interacts with other medications, making side effects more likely. Safer options are available. For allergies, second-generation antihistamines like loratadine or cetirizine are less likely to affect brain function. For sleep, behavioral strategies or short-term use of other treatments under a doctor's guidance may be better choices. The key is to avoid relying on diphenhydramine for long-term use. If you have been taking Benadryl or a similar product regularly, check the label and talk with your doctor. Do not stop suddenly without guidance, especially if you are using it to manage sleep, but do begin the conversation. Understanding how even a simple over-the-counter pill can affect your long-term memory is the first step in protecting it. Your brain is your most valuable asset. Treating seasonal symptoms or short-term sleep troubles is important, but it should not come at the cost of your clarity and independence. With the right advice, you can make choices that help you stay sharp and healthy for years to come. Number 1 is anticholinergics. Anticholinergics are a broad group of medications used to treat a variety of conditions, including allergies, bladder problems, nausea, motion sickness, and even some symptoms of Parkinson's disease. They are found in both prescription and over-the-counter products. What links them all is that they block a chemical in the brain called acetylcholine. Acetylcholine plays a vital role in memory, attention, and many other brain functions. When this chemical is reduced, the brain does not communicate as well. This is especially concerning for older adults, because natural levels of acetylcholine tend to decline with age. Adding a medication that reduces it further can cause or worsen memory problems. Some well-known anticholinergic medications include certain sleep aids, antidepressants, antihistamines, and bladder control drugs. While they are prescribed for different reasons, they share the same brain-related side effects. These can include confusion, slower thinking, drowsiness, and increased risk of falls. More alarming is the connection to dementia. Several studies have confirmed that long-term use of strong anticholinergic medications can raise the risk of developing dementia later in life. One of the largest studies followed more than 3,000 adults and found that consistent use of these medications over several years was linked to a significantly higher risk. These effects are not always immediate. A person might take an anticholinergic medication for sleep or bladder control and feel fine at first, but over time, as the drug builds up in the system and interacts with natural aging, the problems can slowly increase. Unfortunately, these subtle changes are often overlooked until they become serious. The challenge is that many people are on multiple medications that may have anticholinergic effects. When combined, even low doses can have a strong impact on memory and thinking. Doctors may not always realize the cumulative effect unless the patient or caregiver brings it up. If you are taking more than one medication and feel mentally slower, more forgetful, or confused, it is important to ask your doctor whether anticholinergic side effects could be playing a role. A medication review can help identify and possibly remove or replace drugs that contribute to cognitive decline. Staying informed is the first step. While these medications have their place in treatment, long-term use in seniors can be risky. Knowing what to look for and when to ask questions can help you or your loved ones stay sharp, safe, and independent for as long as possible. Now that you've seen the full list, it's clear that some of the most commonly used medications, ones prescribed for sleep, allergies, anxiety, pain, heartburn, and even bladder control, may carry serious risks for brain health, especially as we age. These drugs are often helpful in the short term, but when used regularly or long-term, they can quietly affect memory, thinking, and overall cognitive function. This connection is rarely explained during a quick doctor's visit, but the research is growing stronger every year. We've covered 9 different types of medications, including anticholinergics, diphenhydramine, benzodiazepines, proton pump inhibitors, statins, opioids, bladder antimuscarinics, NSAIDs, and beta blockers. Each of these has been linked in studies to increased risks of mental fog, confusion, or even dementia when used continuously over time. Some directly interfere with brain chemicals, others may reduce blood flow, alter nutrient absorption, or interact with other medications in ways that hurt cognitive clarity. It's important to remember that not everyone will experience these side effects, and these medications are not inherently bad. In fact, they often serve an important purpose, but awareness is key. If you've been using one or more of these medications and have noticed changes in your memory, mood, or alertness, it may be worth revisiting the conversation with your doctor. A safer alternative may be available, or a lower dose might work just as well with fewer long-term consequences. At the Wellness Vault, our mission is to bring you the information you need to make confident, informed decisions about your health. We believe that protecting your brain starts with understanding what you're putting into your body. No one should have to choose between managing symptoms and maintaining mental clarity. With knowledge and the right guidance, you can have both. If this video helped open your eyes to something new, please take a moment to give it a like and subscribe to the Wellness Vault. We release new videos every week that focus on longevity, cognitive wellness, natural remedies, and practical tips for healthy aging. You'll get science-backed insights without the confusion or the fear, and we want to hear from you. Which of these medications surprised you the most? Are there any you or a loved one are currently taking? Share your story in the comments. We read every single one, and your experience could help someone else. Until next time, take care of your body, protect your mind, and thank you for watching the Wellness Vault.